welcome back to the show. Today I have a really special guest. We worked together. It was only like a year, right?
Was, yeah. Yep, you were
It was
pregnant
only a
already
year.
when I came on. Yep, absolutely.
It was only a year, but it felt like more.
Yes. Yeah, when
In
you
a
do
good way.
cattle, in a good way. I feel like it was the cattle work that made it feel kind of terrible. And that's about it. Me and you were great.
Yeah.
I definitely think it's the cattle work that made the day very long.
The days were long, the years were short.
Yes,
But
right.
I have Erin Kreutzer with me. She's a licensed vet tech and soon to be veterinary institution owner. So, Erin, tell us a little bit about what's going on with your life, what you got going on.
Well, right now I'm working for the city of Arapahoe. It was kind of a means to an end to get me closer to home because I have purchased the little Groom and Board, which is an old vet clinic in Holbrook, Nebraska. And the idea is to bring vet care here in small town because the nearest vet is Beaver City. So from Holbrook, that's anywhere between, I think, around 25 to 30 minutes away. And people don't want to travel that far. So it's really hard for them to be like, well, I have to travel a half an hour, make the appointment. So I have to pay the office call to get my animal in and pay $150 to get it vaccinated. So the idea is I'm going to have vets around the area participate in clinics so people can show up, at my little clinic to get their animals vaccinated. And at the same time, advertise, for the vets that come in and help their services so that people can pick out which vets would be a better fit for them. So that way they can show up for like a primary care provider for their animals and not necessarily just to go get vaccinated, but for those big appointments like surgeries, blood work, things like that. So same thing with like equine dentists come down here and haul in the horses here and have an equine dentist here because people are like, where do I go to get my horse, teeth floated? That's not going to cost me $1 million. And I have to haul them an hour away. Then have that vet come in and advertise for their other services like equine breeding programs, things like that. So having vet care come here closer to town is my goal.
Yeah, and that'll probably help break down the stigma or the barrier of actually showing up to the vet.
Absolutely. So because people into going into the vet to spend that money and that time on a Saturday, they're like, man, that's just so much money. It's also a money barrier, as everybody knows. Vet care is expensive. It is, and sometimes it's unattainable in some, where people are single and they want that vet care. They want to be able to board their animals and they just can't. So a lot of times they're asking family or friends to watch the animal because like I can't afford $200 worth of vaccine appointments and boarding at the end of the day. So the goal is to make it affordable, advertise for the the people where they're going to be needed in real situations that people need them, but not break their banks. And they can meet a whole arrangement of vets coming in. So absolutely.
That's so good. I love that plan. I love bringing it in for the rural cities villages.
Villages. We are few
so
and far between.
So, how long have you been in veterinary medicine?
Oh my gosh. So I started washing cattle tanks when I was 18, and it kind of started from there. I started processing cattle about that same year, and then I went to vet tech school shortly after. Let me see, 2010. So 14 years. Yep, wow. An official vet tech. Yes. Yep. So small and large animal. So been doing it a long time. Yep.
So, which is your favorite? Do you prefer the large? Do you prefer the small?
I love large animal. The people are amazing. Cattle are, it's hard. So I love it. And you get to be outside all day. It's just the older I get, the harder it is on my little body. So it's definitely a transition. So I prefer large because I love equine. I love bovine. I love all of that stuff, being outside, and the producers are amazing. But, I am going to pivot, right, like you said, more towards small animal because I'm getting older but I do prefer large.
What drew you to working in the vet space and with animals?
So I was actually mechanicking when I got asked by some random like rancher. He's like, hey, do you want to come work at the feed yard? I'll just be having you wash tanks, if you're looking for a different job. I'm like, yeah, sure, that sounds great. And so I jumped in, started washing cattle tanks that summer, and I was like, I love this life. I love being outside. The cattle are great. Working with the producers was great. So actually mine started out as just washing tanks at a cattle place, and it was great. So that's what got me started. Then, started getting into cow calving after that. I really saw how amazing, cow calving was. And I liked the calves and pulling and being up, and yep. So it was definitely just by chance. Someone asked me to wash cattle tanks during the summer, and I said, sure, that would be great. Yeah.
Yeah, and it is kind of like almost like a Narnia go through the wardrobe.
It
Big.
is. Yeah, because
Those
I
are
didn't.
whole worlds.
Yeah, because I didn't know. I was only 17. I wasn't really looking right yet for what I was going to do with my whole life. And that's kind of where it led to. Yeah,
I love it. I love it when life just,
it does. This is what you're supposed to do.
yeah, yeah.
Yep.
And you spent several years running a shelter, right?
I did. Yep. 4 years I did. So I got to see a lot of miscellaneous, you name it, hit by cars, people that could not take their animals with them when they were moving, people that they knew their animals had medical problems and they couldn't afford the care. So like a diabetic animal, we would be happy to take and educate the public on them because they were not healthy, and we were able to get them on meds, and we were able to adopt them out as healthy animals. And these people were really grateful. To dog fight ring dogs, those came in. So I got to see a huge amount of different things come in, and that was a really great experience. So I got to help a lot of animals and a lot of people. It's a very fulfilling job. Yep. Something that I would do again, which I guess that's kind of what I'm going to be bringing in, kind of like this kind of thing, but boarding and people that need, affordable veterinary care kind of stuff.
Yeah, it's kind of the best of both worlds because you're still going to get to use your management side, your teching side, and you're going to be able to oversee it all. And with all of your experience, you're going to be able to make the decisions that you feel comfortable with.
That's right. And where, like you said, I have so much experience with that, I'll be able to make the choices that are like, well, this seems expensive and I can't, or, advise other people like, this is, go see this person because this is what I think, could be, and I think it's an issue. Or yeah, it'll be really nice to be able to gate, to pivot people where they need to go based on who I know is a better fit for, like a large animal emergency or an equine dental problem, or, things like that. So it'll be the experience that I've had will be very helpful, I think.
Well, I'm really excited. I love this business plan. I love the whole idea. I love what you're doing. I literally can't wait. I'm gonna make flyers
For you, and I'll be passing them out because I love it.
Guys, go see this lady.
Yeah, and I love the way that you approach vet med and how you approach patient care. All of that, I have very high respect, and you taught me a lot in the few months that we had together. I learned so much from you, so lots of respect for you.
Thank you very much. Oh my goodness, I had no idea.
See, this is why you're supposed to tell people what you're thinking.
Good. That makes me feel better. Like someone, I helped somebody anyway.
Oh, girl, if you hadn't been at the clinic when I was pregnant, I think I would have died. I would have been behind the chute, just like laying out. Someone come help me.
No,
let me die here.
Yeah. And you were my pregnant lady advocate. So every time I was looking a little peaky, you were like, go get a snack. Did you drink water? Here, take this for heartburn.
Because I was that person at the feedlot and I was all alone because I worked with a bunch of dudes that were like, she seems fine.
What animals do you currently have that are yours?
So I lost my old Leopold last July. I still cry over that little old man. And I had to send him to heaven. He reached 17 and he was just not doing well. So right now I have Rhea, my little short hair pointer. She's 7 or 8. She's about Maverick's age. She's squirrely. She's gun shy. So I got this hunting dog who is, of course, gun shy. But she's a great family dog. She listens. She comes and goes. She stays in the yard. We have like 6 acres out back. She runs. She's great. And then we have 2 horses that we ride. So these were also feedlot nags. One had a really bad ulcer. And as you know, cowboys are not great vets. So they just wouldn't work on her. So I got her for a song. And then the other one had a cough. She had really bad hay allergies. Same idea. She had, they weren't treating her with antihistamines or anything. She had developed like a pneumonia, and I got her treated right up, and she's a great horse. So I got 2 horses for basically a song and some healing. I know. Like cowboys.
Don't discount the cost of Butte, okay?
Oh my God, so much.
You paid for those horses.
Yes. Yeah, you're right. You're right. And the time it took, because again, you have to wet down their hay because one has that cough, they have heave lines and blah, 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 blah. Oh yeah. But so by the time it was all said and done, right, I basically, yes, paid for those horses. But they turn out great, and they're really good kid horses. So they don't have a buck in them. One is not particularly a fan of a saddle. She doesn't like a cinch around her belly, but she just tries to, if I saddle her up, she'll try to get you. But after she's saddled, she's great. She loves bareback. She just doesn't like a cinch, but really good horses. So just the 3 for me.
Well, and remind me, Leopold was a pointer.
He was.
17 is very impressive.
Yes, and he was really ridiculously healthy at 16. He started developing like a little fatty tumor under his arm, and I was like, well, he's 16. I'm not going to put him under surgery. Still was a run around, like he crossed like a line where he was no longer healthy. He was one day, and the next it was oh gosh, this is going to go downhill rather quickly, and it did. So, I mean, we weren't babying him along. He was ridiculously healthy at 16. Mm-hmm. And one morning he was not able to, his hip was started going downhill, and we put him on Galliprant, and that got him through for a while, but it was day and night. So, but it was fast. Yes. What about you? You still got your bulldogs, right?
I do. Yeah. I still have Drax the bulldog. I think he's almost 4 now. And then I still have Coda, my Australian, and he's 8. So we have officially entered old man territory.
And he's doing okay. Is he doing okay?
He is. You can tell that, well, we have a toddler in the house, so it's a little bit easier to see his age showing when, his hip hurts. Don't put weight on his hip, or, he's a little bit crabbier. He's not snapping or anything, but he has much lower tolerance. He just leaves the room a lot.
Like, I'm not today. I'm not doing that.
Yeah. And he's starting to get some gray hairs on his muzzle, but I'm really hoping I have at least 5 more years with him. I think he could make it.
I hope, and again, it's all about diet. People, there's so much to diet and weight, maintenance in animals that really make or break how long they survive. Absolutely. Leopold was on a really healthy diet. He was free fed, but he regulated himself. He maintained his normal weight his whole life. And then we put him on joint supplements, which I feel like, again, really helped him get to 16, because it has that fish oil for their heart and their joints. So I really support, as hip and joint supplements at some point I think it's very helpful.
Yeah, I love that you said that, because we've had Coda on joint supplements, I think, since he was 5. As soon as he was like mature, I wanted to get him on that. And then I think the year before you came to the clinic, Coda weighed over 90 pounds. He went from being an outdoor dog to being an apartment dog, and he was always free fed as well. And so he gained weight very quickly, and it took us about 1.5 years to get the weight off, but he's back down to about 68, he's a big Aussie, if you remember.
He's
one of the
tallest Aussies you'll ever meet.
He is massive. Yes.
Yeah. So actually recently I just upped his feed because I was like, oh, old man skinny, you need more groceries. I'm so sorry. So I'm really hoping we can get lots of life out of him. He's on a geriatric food already. So, more joint support, more fiber, all the things.
Little old man. She's probably moving up for Rhea. But again, she was on hip and joint supplements too. When we had Leopold, we just doubled up. So it was easy. Yeah. I mean, she was already there, so why not? Yeah. Yep, and she's doing really well.
We don't have to keep this in the pod, but we might. What is your favorite joint supplement?
So we use the Purina Pro Plan hip and joint.
Me too.
Yes. Yep. And it works so well. I know Dasequin is a really good one as well. That
Oh yeah.
people like to go with, but also very expensive. Very exactly. I was like, with that being said, if you can afford it, do.
Yes.
If you can, great. If you can't, Purina is very good. Yep. So we do a
Yep.
lot of propylene stuff as well.
Yeah, we're still on quite a bit of proplan as well. I love the supplementation. I used to also give my dogs a ton of fish oil.
Yes,
breakfast every
and
day.
people do that too, and it's still very helpful. Skin,
Yeah.
joints, heart health, very good. Yep.
Yeah.
People do a lot of flaxseed too. So,
Yeah.
yes,
There we have it, the key to eternal youth for your dogs.
we do it for the dogs, but not for me. I don't think I take anything. I eat healthy.
Yeah. The time I'm most consistent with any sort of supplement is pregnancy. As soon as I'm done with the, the fourth trimester, out of the newborn phase, I'm like, what are vitamins?
Me too. I'm like, what is that? I give them to my children, but as a mom, I'm like, why am I so tired all the time? Coffee? No breakfast?
Yeah.
I'll eat here and there.
Rode hard, put away wet.
Exactly. And my dog's taken really well care of along with my kids. But as a mom, it's just, I get it. It's so funny because you'll do it for your kids and your dogs. But as the mom, you're the one that's like getting ran around the most, I know.
Definitely something we can work on, but that's that. It's farther down on the priority list.
Later on.
Yeah. Okay, so you have a ton of experience with canines in a clinic setting in a stressful space, and that's what I want to talk to you about today is how we can prepare our dogs for that. What are some choices we can make in the moment?
So in general, most people, they train their dogs their names, which is great. Obviously their dog needs to know their name. It's also when your dog goes into a building, there's probably going to be other dogs in said building, and a lot of people aren't prepared for, hey, there's a dog that might not like my dog, or my dog might not like this other dog, and now my dog doesn't know the word no, or have a distraction that could possibly be like, there's a treat instead of a dog. Now I'm more interested in the treat than the dog. But a lot of times if people walk in unprepared for another animal being there. So I feel like if they could train their dog to be around other dogs, like dog park example, or take them for a walk, where other dogs might be present, and teach them about distraction or the word no, say a name and then the no command. People skip over that no command a lot. And I feel like it's very helpful because if you say, just like to a kid, no, immediately they know, don't do that, don't touch that, stop doing what you're doing. A lot of times people skip the no command, and I think it's a huge deal, and it's a lot of times it's a deal breaker in a dog fight. If it's a no, the dog's like, oh, I know not to do that, so I'm going to stop immediately. And it's not necessarily, I think no should be before come, and a lot of people forget.
Oh, absolutely.
Right, because there's that middle step that people are not aware of, stop and then come, so it's a big deal. Either a no or a stop command, I think, is very helpful in any situation, because just like in a horse, any command is great, but if you don't get him to stop first, the horse is going to keep going to do whatever you don't want it to do. Jump, run away, cut the wrong directions. It's always in any animal world, stop or no is should be the first. And I've just seen so many things go south when that has not been established in an animal. So like when I say Rhea, no, she's like, I'm going to stop what I'm doing and I'm going to come over and do the next command. So I'll say, come here, Rhea, no. So things like that. It's very helpful to know that a no command exists. And a lot of people are like, I haven't even thought of that, and it's important to know that, yes, say no to your dogs, just like your kids. Do that, and you'll save a lot of things that you're like, oh gosh, this could have been, you could have evaded this if you had done that, as an owner. It's very important going into a clinic setting. Yeah. So that is my biggest that I have seen turn into something bad.
The no command is something you can teach immediately. Like as soon as you get that puppy home, as soon as you have them in a car, they do a behavior you don't like. No, move it, give them something else to do.
Absolutely. It's no and distraction. It's how, and it works immediately. It's so quick. They're quick to learn it, especially when they're young and they're new, and you just keep doing it. And then it's so much easier because then it's instilled, just like sit. I mean, it's instilled in their brain as fast as you can say sit, and it's, I think, the most helpful. Sit is great, but it's just a trick command most of the time.
Yeah.
No is saving your dog's life from running into traffic or a dog fight or some other terrible thing. So yeah, I think the no command is probably the biggest in my book, where I've seen it be very useful.
Yeah, I should definitely add that because I have like a list that I talk about all the time. It's the 5 first things you should teach your puppy. And I should add that because it feels second nature. But honestly, if you don't have a form of discipline or correction that you're using, you're not really training your dog.
You're not, right, because it's the initial command. It's your name and then no. And then like, I have to take a second to realize what I'm doing wrong. And then, and a lot of times the older they get, it's immediate. They'll stop doing it. But because they're properly trained to not do that thing that you use that tone, no, in doing.
And that could also look like with the cattle dogs, we use right there. You could use wait. You could use stop. But they're all the same thing. But you need to halt motion. You need a command that just makes everything stop for a second so you can fix and address.
Right, catch up and then do the next command, right? Like cattle dogs, they do pass or by or away. So, but you have to get that dog's attention first, and not necessarily just a name, because if you say their name, they might just keep lollygagging along. It's a no, it's a Rhea no or Rhea stop, and then come.
Another thing I would like to say is that because not everybody raises their kids or trains their dogs in a way that we do, is that you can't just say no and not follow through. You're going to have to follow through. Otherwise, no becomes another jumble in the bunch of English words they don't care to know.
Right. Right. And with any other command, they have to know what you're talking about. If you give them a command of 5 seconds too late, they're going to be like, I don't know what you're talking about. And they've missed it. You've missed the opportunity to say, no, don't chase that chicken. Because if you see them chasing chickens and you're letting them do it for any second, just with any other animal you're trying to train, it has to be relevant at that moment for them to be like, oh, stop doing this right now. A lot of people say, well, or when they walk into the house and the house has been destroyed by your dog. You can't punish them after the fact. They've already done it. They're confused. They're like, now, why are you so mad? Because they didn't catch them in the act. So you have to catch the animal in the act to train said animal in whatever it is, the stop, the don't eat my shoes, in the act. Otherwise, it's too late. And then they're confused. They just don't know what you're asking of them. Otherwise, it's irrelevant. In their brains, it's past. It's, well, I ate the house and mom was gone. An hour or two later, or at the end of the day, why are you so mad at me? They have no idea. They can't correspond that you're mad because the house has been destroyed unless you catch them destroying the house.
Yep.
So it has to be relevant at the time. Training is very on time commands kind of thing.
Yes, timing is everything. And to add, you were talking about not letting your dog be in other dogs' spaces. And in order to do that, you need to make sure that your dog is on a leash when they enter the vet clinic. Don't let your dog run in there.
And so as a vet tech, you kind of like, you've learned to like look out the window, because people do, they're like, I didn't even think about it. Because again, they must not bring their animals into a clinic setting a lot. So again, hopefully they know that stop command, which is going to come in handy if they don't realize that they need a leash. But yes, please bring your dogs in on leashes. It's very important, because if there's a pit bull that is very large, it's waiting in said waiting room, and it is very known to not like other dogs, your animal could get hurt, or the vet tech or the veterinarian breaking up, a dog fight. So make it a good meeting where your dog wants to come back and your dog hasn't been traumatized in said dog fights.
I like the way that this is kind of going. We kind of covered when you enter the clinic. Now let's kind of talk about what we could do to help them for an exam. So when they're about to get picked up on the table, they're about to get poked, prodded, touched all over, what are some things that we should be doing to prepare them for that as well?
So I also believe a lot of this is breed based. So, before, it is absolutely. So you have a husky, You have a husky. This summarizes people that have huskies. They'll know what I'm talking about, or vet techs that have worked with huskies. You have a husky. They hate being touched, period. And they're very opinionated about it. So huskies, in that particular situation, for that example, a lot of times the owners know my husky is so dramatic, I will do the holding, which in a lot of cases, in my experience, has been great. So they can hold their animal if you show them proper technique, and the vet tech can hold the arm for blood, for drawing blood. So in that case, it's a lot of owner vet tech teamwork. But if you have a squirrely Labrador, you know, the owners are like, he doesn't mean anything. He just moves a lot, which is great because my parents have Labradors and they mean no harm. They're just giant idiots.
Yeah.
And they don't mind being held by strangers. So a lot of times it's easier if you say, hey, mom and dad, if you wait in the lobby, I would be happy to, you know, hold said Labrador while they squirm. And they're usually more than happy to be held by a stranger. So a lot of this is, has your dog been, you know, out and about in public settings, in a clinic before? Is this the first time? Is it a puppy? What's the age? What's the temperament? Does it like the vet tech that's in the room or the veterinarian? You know, a lot of times you can read this based on, you know, how is the dog acting?
Yeah.
So again, there's so many avenues to, you know, helping owners, you know, and it's, you know, what do the owners know about the dog? What do they know about the breed? Do they know that they're squirmy or opinionated or have done the training? You know, a lot of times people, they'll teach them to sit, stay, shake, but not necessarily stand for a vaccine. So it's all, what are they willing to let the vet tech do? You know, hold the animal down. Is it, if it's a very dramatic, you know, a lot of dogs will try getting a little bitey sometimes or growly, you know, are they going to allow you to hold the animal properly for said appointment, or does it make them extremely uncomfortable and they would rather? So it's a lot of situational and or breed in my experiences.
Yeah, and this doesn't have to be on you as the owner to figure out all these things. If you have a vet staff that is willing to, you know, sometimes think outside the box or even just like assess what you and your pet need, you know, they'll help you make that decision. This doesn't have to be your decision, but bring what you know to the table so that we can then make a decision and help you figure it out.
Yeah, they're going to know their animal best most of the time. They're going to know my dog hates this or my dog loves that. Or in the event that they're like, oh, I didn't know my dog hated that. Next time you can make a better game plan together. Like you said, work together for a better game plan.
Something that I would love to see more normalized is for pets to just come into the vet clinic and get a milk bone or like a treat and then leave.
Like, come in, have a cup of tea. We'll see you later. Right? Absolutely. You know, and because they're like, this is not a scary place. I agree. Just come and say hello. Meet staff. Be like, this is a normal setting. You'll be here once a year. Hopefully, you know, you're a healthy animal. Hopefully once a year. But yes, come and say hi to staff on a random day, on a Saturday. Go for get a cup. Go say hello to your vet. I agree. I think it's really helpful. If you have the time, absolutely.
Even step on the scale, get them used to stepping up on that. I would love to see that happening more. And the people, so me and Erin, we worked in small towns primarily, right?
Yep. A lot of small towns. Yep.
So we would have people doing this unintentionally just because they were bored or, you know, they bring their pets out for a ride. And there were definitely patients that we saw lots just to say hi, give a treat, and maybe trim one dew claw.
Yep. Yeah, or my dog's got this ear, shaking his ear. And it's always like little people, little guys bringing in their cattle dogs or their cup of coffee. And it's great. It's just, it warms my heart. So yeah, same experience. Absolutely. But it made the dog better and they were welcome. They were allowed to roam or say hello anywhere. And it made treating them much simpler. So
yes.
Something else that I would love to see is, as owners at home, when you have a dog, that you touch them all over. You pinch them, you poke them, you hold their hands, their paws, rub them all over. Because the more you do that, the less they're going to freak out when we do that.
Check their teeth also, because sometimes you have to medicate that animal and they are not used to you opening their mouths to put pills down their throat. So save a vet tech's fingers.
Yes.
And your own, and please mess around with teeth. Plus, you get to see that, you know, your dog's dental health And a lot of people don't realize dental health is also linked to heart health, because in the event your dog has severe plaque, all the bacteria is building up around their heart. So it's like a threefer. You know, you save your time on pilling, you're checking teeth along with heart health. So check teeth. It's very important.
And something really cool about most vet staff is we want to teach you how to check your dog's teeth.
We're so good at it. We're so good at it. Just ask us. We'll do it. Yes. Absolutely.
What would you say is a good way to help lower your pet's anxiety when they're in the waiting room, or, you know, waiting for the vet staff to come back with their treatment? How would you recommend that owners remain calm and calm their dog?
So just like with kids at a doctor, it's all about distraction, and a good one. Like, make it super convincing that this is a normal spot. Make it them think it's like, we're here for just me. We're just here for say hello. Like, it's about, what's your dog's favorite treats? Where do they like being scratched? Can you walk them around and maybe meet and greet staff? Let them sniff other places if at all possible. Like, if you're the only person with your dog in said clinic, see if you can just walk around, bring a treat, meet staff, make it like a very calm, normal environment. Make them, say it's okay. Calm voices make a huge difference in animals' lives. It's especially as an owner, your voice, they'll know. So you have to be convincing that this is a happy distraction. It's a very calm place and everything's going to be okay. If they know that you're tense because they're tense, it's going to explode, and they know that. They can sense that. So be as calm and convincing as you possibly can, and just go about your day normally. This is a perfectly normal day. Carry on, bring a treat or distraction, and see if they can make friends with other animals if the other pet parent is agreeable with that. So if you can make friends while you're there, do, because then they'll be like, oh, this is a great place where my friend Buddy was at, so for them it'll be a good experience with a distraction and some friends.
Yeah, absolutely. And most vet staff love animals and are there because they love animals. And as long as it's not a terrible, stressful, awful day, which does happen, a few days out of the week, they want to interact with your dog, and it makes their day better. So it's okay to go up to these front desk ladies, to whoever you see in the lobby. They will interact, they will be there for you, and even ask them for a treat. Oh my gosh, my favorite job was being the treat lady.
Yep. Ask, say, my dog is about to lose their biscuits, can you help me? Ask us, because again, we have that experience. We know animals are not comfortable. It's not their normal setting, and they for some reason can smell, I don't know, the chemicals at the doctor's office or what it is, but they absolutely know that something is up, and this is not Disney World like you promised in the car ride. So let us help you by, saying, hello, I'd love to meet you. Here's your treat, right? Ask staff. If you know your dog is having a really hard time, don't hide it, because they know that you're stressed, and so that makes them more stressed. So do ask, your vet tech to help out, because they're, like you said, more than happy to jump in.
Yeah, absolutely. And you don't have to be like ashamed of your dog's behavior unless you are actively letting them act out. Like, unless you're a part of the problem. If your dog's a little naughty, like, we will help you work through it. We're not judging you. But if you're not correcting them and you're not holding them in line at all, then we be judging.
Right, because that they are, the ones pulling the stuff off the aisle, like at the Walmart. Don't let your animals do that. Don't pull the stuff off the stuff, or get in other dogs' faces, or jump. A lot of times it's the jumping, being in people's faces. That's very invasive, and I don't like it either, because at some point it can turn from excitement to nipping, very quickly, and they're like, now people are mad at me, and why? The same thing as that command thing that they've missed. Now people are so mad at me. You let me jump 10 times and now you're mad. It's very confusing. So try to nip that pretty quickly, because jumping in faces, so misbehaving and vet techs, loud misbehaving in vet techs, they get a little perturbed if not handled pretty much immediately, because there's lots of other staff. Patients waiting, and usually waiting in the room. So it's causing havoc across the board.
Yeah.
And it's making all the other dogs nervous. And there's an 8-year-old poodle mix that's curled up on her her mom's lap, and she's shaking because your dog
And
is
she's
barking.
about to snappy because she's done with your baloney.
Yeah. And then that lab puppy sticks his big fat nose in her space, and she's
Oh, yes, the sound. I just can hear it, that quick.
Yeah.
And then there's a little dog fight or some hurt feelings. Either it's going to go one way or another. That poor dog's going to be like, oh my God, that dog yelled at me. Or a little dog fight will ensue. So one of two things is going to happen. But yes, training is important. Yep.
Yes.
Or exposure. Exposure is training in its own
Yeah.
exposure. Expose them to every aspect of things, touching, seeing, smelling, being in places. Yeah, exposure is also its own form of training. So absolutely get your animals out and about.
Yeah, if there was a theme that I could take from every guest interview I've done on the podcast, is that I think the way that I put it last time was 90% of training is socialization.
It is because, again, if you have a dog that's predictably neurotic, let's keep going back to that husky, because they are predictably neurotic because they're just that way, and they're just built that way. They're predictably neurotic, and then you put them in an apartment their whole life, and you only take them out to go to the bathroom, and you never take them anywhere but in and out. Well, then you have a vet emergency, or suddenly you have to board your animal and they have to go in for vaccines. It's going to be a failure across the board for you. It's going to be the hardest experience of your dog's life. And it's just not going to be fair to veterinary staff, but especially that dog. That dog didn't have a chance at behaving or having a good veterinary experience. So across the board, absolutely get those animals out. It's okay to have an apartment dog. It's okay to have an apartment husky, but do right by the animal and get them out and about and train them and spend time, with those animals.
And honestly, any breed can live in an apartment if you're willing to put in the time to exercise them mentally and physically and show up for what they need.
Right. I mean, any even people, if you just sit in your apartment, I mean, you're just not going to do well when you go out in public. You're just not going to be exposed well. You're not. Anybody that's just sitting there, anybody sitting in an apartment all day, every day, doing the same thing, you don't do well with other situations. So get those people and animals out and active.
I can't help but compare it to the first outing when you're postpartum and you've been just in the most feral state you've ever been, hovering over this child. You haven't showered in days.
You're exposed to sunlight and you hiss a little bit,
and then you go to the doctor and the first thing out of your mouth is awkward, or you just feel awkward the whole time.
Blurt out, I haven't showered in a week, and they're like, fine.
Yeah, and they're thinking, we can tell.
Any mom has been there. It's so funny because they're probably like, yes, me too. My first experience going out with my kid. Yes, it's ridiculous, but it is same idea.
Okay, we've kind of talked about vet etiquette a little bit, but I want to get really clear on it. So I'm going to kind of summarize what we've talked about, because there's so many people that just don't know how their dog is supposed to act as a vet, how they're supposed to act as a vet. So just to be really clear, we've talked about not allowing your dog to greet other dogs unless they are calm and you have talked to the owner. And then it is also important to respect people's space. So if I was your tech and I came out to grab your dog and your dog jumped and licked me on the face, that is not proper etiquette, because I could have died.
Right, because I don't know if your dog is a bitey kind of jumpy or a licky kind of jumpy. What kind of jumpy are we?
I have experienced both, and it is terrifying.
So for you to not have control of the leash or the dog scares me a smidge. Absolutely. Because you just don't know if I'm coming home with stitches on my face or not.
Yes, and when in doubt, trust your tech or your vet when they're telling you how the dog needs to be restrained. If the dog needs a muzzle, this needs to be said over and over again that good dogs wear muzzles.
Right, it's not a punishment, and they live a very, very normal life in a cage muzzle. If you know your dog does not like other dogs, that's okay. But don't keep them locked up at a park, or on a leash constantly, because then again, they'll know they can't bite, and eventually it could be used as a training tool. It's
Yes.
very helpful. If you know your dog does not, but you want them to live a normal life, to go on dog parks and walks and stuff, put your dog in a cage muzzle. They can drink water through them. They can pant. Cage muzzles are very good, useful tools. They do look terrifying, but they are not. They're just a training tool.
Scary dog privilege. No one's gonna come and talk to you.
Nobody, right?
got
They're
a
gonna be like,
muzzle on.
oh, that dog eeats people for breakfast. And it's not true, but it does look like that.
Yeah.
And if it can take your anxiety down, because at least half of the problem is because you're scared that your dog's about to do something bad. So then they're scared, thinking that they need to do something bad.
Go get fitted. Go try one on. I agree. Invest in one if you know your dog just doesn't like other dogs. It's very
Yes.
normal. Yep. Very
Yes.
normal.
And then the final thing that we didn't talk about, but because most vet clinics and vet staff are highly superstitious, do not tell me that your dog will not bite.
I've been told this a time or two.
I would rather be told that your dog has bitten before than be told that my dog doesn't bite, because your dog does bite. Just depends when.
Right. Or it's also the classic, oh, weird, my dog's never done that before spiel. When I'm sure they have, but you just thought it could never possibly occur again. But right, let us be prepared. Give us that, like, it's okay. Your dog's at a strange clinic with strangers holding on to them, and there's going to have a procedure. It's perfectly normal for them to act out, especially when they're terrified. But give us the upper hand so we can be helpful.
We had a patient come in that he was very, very sensitive about his paws. He was a very sweet dog, but he was a rescue, and his owner knew that if we touch his paws, he's going to try to bite. So she would bring chopped up hot dogs. She had a muzzle that she was training him to put on. And I think it took 9 months, but by the end of the 9 months, we went from him shaking, trying to nip every time I touched a paw, to him sitting like a sphinx, very still, to let me trim his nails, eating a hot dog at a time, and walking out with no incident.
Awesome.
So there's
And
hope.
the hot dog, I think without that special treat, it would
Yep.
not have had the same effect. It
I
does.
totally agree.
Yep.
Because
So it has to be
to
something
get a nervous dog to
spectacular.
eat.
It does. It does. And it has to be something they're willing to take in any situation. Bacon, hot dogs, cheese,
Yeah.
whatever is different that they don't get at home normally.
And save it. Save it for those big moments.
Yep. So don't start giving it regularly, because then it's not special anymore. Keep that for big time. I'm going out. We have a vet clinic appointments or a park appointment, something. Make it big and special every time. I agree.
Yeah.
Don't overgive it. Otherwise it won't work.
Okay, so we've talked about a lot of the things that could go wrong with a dog that's not prepared, but what does it look like when a dog does it right? What does it look like when your ideal patient comes in?
Oh my gosh. It's a walk in the park. You're like, I've got this in the bag. And you're like, this went that fast. A 90-pound Labrador got its nails trimmed, its ears cleaned, and anal glands in under a half an hour. What? We're having a day, people. Celebrate. And then that dog is so happy. They're like, well, that was fun. Bye. When they're happy to come and go, you've won. You've won that appointment and that dog and that owner. And that owner wants to bring that dog back because A, it doesn't waste a whole bunch of their time. B, the dog is happy in and out. Your appointment went really well, is super successful. And that's the ideal day. You come in, your dog's stoked about being there no matter what they're there for, and you do a million things. That dog's like, sure, yep, this is great. Yep, this is nice. This does not bother me. And guys, this was great seeing you. Thank you for my treat. I'll see you guys next week or whatever. That's the ideal appointment where everyone's had a great time. The visit was short and sweet. It was great. Nothing new. The vets had a great, appointment with their techs, just had a great morning, in and out all along. Very relaxed, very chipper, in and out all along. Very quick. People are happy to see that dog.
Yeah, and I think the thing that really stuck out to me that you just said was nothing new. There's one thing you take from the episode: nothing new on vet day. You've already experienced everything, we've practiced everything, and Like, it could be so simple. You could be practicing these things at home. You could be practicing them at the park. Just nothing new on vet day.
Absolutely, because then it makes everybody's life so much easier. It's predictable. It's a
Yes.
predictable day for everybody across the board. You know the dog, you know the appointment, you know the procedures. Easy peasy. Even vaccine appointments that are usually only once a year. If they're used to standing for whatever it is, nails, anal glands, whatever it is,
Yeah.
it'll be simple. Just as simple. I mean, they might have like oh, that was weird. But where techs and veterinarians are trained to do vaccines, we're very fast, we're efficient.
Mhm.
It's usually painless. So they'll have no idea that the appointment changed regardless. It's still just across the board a normal appointment for them.
And I would also like to add that a lot of the best patients aren't actually like very well trained. They're just very well exposed.
They are. It
Like,
is. That's why I said expose them. Take them out.
yeah.
Exposure. Absolutely. Life's
Yeah.
normal. Go out, let them be everywhere. Because the more, and again, the more you work with them with that no command or come or work, it gives them a much better opportunity to please you. Dogs are people pleasers. They want to be,
Mhm.
they want to please you, and they're looking for that leader. So let them do that. The only way to do that is to get them out and about.
Yeah, that's their primary purpose. I talk about giving dogs a purpose a lot, but if you can just give them the purpose of following your leadership, that's already leaps and bounds what they need.
The simplest things like, oh, I came and my mom was so happy, and they're like, my mom's so happy. So that's their goal. That's what they want to do, is to please you.
Yeah.
So yeah, and it's so easy. They love it. And it's easy to accomplish.
I can't help but think of like some of the old basset hounds I used to see that they were basically deaf to their owner. They just like, I walk into this clinic, I own this place. First of all, I'm going to go on my scale, I'm going to get my treat, I'm going to roll over for belly rubs. And that is all that we needed from them because they knew what was expected of them and they were here for it.
Basset hounds, any hounds really, but bassets particularly.
know.
They're cantankerous, like you said. They're like, Mom, I'm not hearing you. I'm sorry, my ears are ginormous, but I cannot hear you.
I'm too pregnant because thinking about their big floppy ears and just like all of the hounds, it makes my eyes water. They're so sweet.
They are so sweet. Oh, they're ridiculous, and they're so chill and so carefree.
Okay.
I think that's the one breed I've never seen like a mean basset hound. Do they come in mean? I just don't think it's possible. I
I don't
just
think so.
don't think it can be.
I think you're right. I don't know if I've ever met
Never.
a mean hound. They're just dopey,
They are.
happy-go-lucky,
Yep, my
lazy.
hearing doesn't work. Yeah,
Like, my hearing doesn't work, my knee doesn't work, but I'm here.
I've got some skin problems around my eyes, but we're here. You don't see bassets very often, or hounds for that matter, but they're really good dogs. And I think it is that people know that they're stubborn, and they hear the rumors that they're hard to train because they're stubborn. So maybe that's the stigma. It's accurate. It's absolutely accurate. Not just a stigma, but people hear it and they're like, I don't know if I want a stubborn dog to train.
But if you want a couch potato,
Absolutely. And some dog that's never gonna, flick an ear at your kids, calling them.
Yeah.
Get a basset. They're the cutest, silliest, cantankerous, laziest potatoes. Absolutely. Absolutely.
okay, this question you can kind of use as a soapbox to, honestly, kind of air grievances if you want. Is there a misconception about the vet staff that you wish more owners understood better?
It's the getting there to get to know the staff that people don't take the time to do. A lot of times people are, in my experience, like, well, they can't possibly know more about my dog than I know about my dog and said condition. And a lot of times that's just not true. Give us the opportunity to help educate you, because a lot of times it's I Googled this symptom and I would know more than you would know. And I'm treating him at home with topical
Apple cider vinegar.
and I have the cure-all. And even though this is obviously not getting better, I guess I'll take my animal in. Don't just assume, because yes, vet clinics are expensive, but we're saving lives. The medication that you have to purchase is made elsewhere, and vets have to make money too. So it's that they're just out to get my money. That's not what we're trying to do. We are in the game of saving animal lives. That's what we do. That's what we've signed on for. That's what we're good at. So, right, don't just come in saying there's no way they could possibly know more. They're just trying to cheat me out of my money. I have apple cider vinegar or lavender oil, but my dog's not getting better, and it's not the cure-all for diabetes. Come in and let us talk to you about it. Don't just assume you know everything there is to know, because we've gone to school. Veterinarians have gone to school for years to be professionals at this. So don't knock it till you try it. Take your animal in and have them evaluated. And then a lot of times people will come out educated. They'll say, oh my gosh, this has been diabetes this whole time on top of a UTI because they have extra sugar in their urine. And that's mostly what I see is my dog's drinking lots of water. No, he's just hot. He doesn't have, I looked into it. It's just, he's hot in the summertime. Don't just assume, go in and see somebody. So it's always that stigma that vet clinics are just out for your money. At-home remedies are best. That's not the truth. Go in and see your vets, because a lot in your vet techs, they care about your animals. That's why we're here.
And also the margin on the profit that the clinic makes is actually very small. So if you want to complain about prices, please complain to the drug manufacturers.
That's my point, right? Vets have to buy it too. It's expensive for them too. So they have to make money as well. Otherwise they can't keep staff. They can't keep their doors open to help. So it's not that we're out to take your money. Medication is expensive for everybody. So.
Well, and the more that you get to know your vet staff, the more that we are able to understand how much you are willing to comply to a treatment plan and what will work best for your life situation, and even figure out the most cost-effective way to treat your animal. But if you're in and out all the time and we know nothing about you, which unfortunately most of our pet owners, they're not compliant with treatment plans. They teach that a lot in CE, that compliancy is like everything. If you don't have an owner that's going to be compliant with the treatment plan, your animal's not going to get better. So then we have resorted to these treatments that cost lots more money, but it's a one-time treatment. So if you're willing to give your dog a pill twice a day, 3 times a day, whatever, you're probably going to save a lot of money. We just need to know that we can trust you to do that.
Right. Because then it's a recurring problem instead of a one-time problem, like an infected toenail. Give them their medication, don't give it the whole dose, everything till the end. Don't skip a dose if you can help it. Give it all the way through. Don't stop midway, and then the animal has that same infection next week. Be like, this is worse. Well, that's you did not comply and finish your medication, and the time, you did not finish it all the way through, or you stopped bathing your dog in that specialized shampoo that treats mange, or or cleaning the ears out after going to the lake. Compliant. Be compliant and diligent about your treatments, because again, we're trying to save you money by recommending the shortest amount of treatment time, but it's thorough and it's got a purpose. Do the full treatment, and then you probably won't be seen again for the same, hopefully, reoccurring whatever it is. So I agree. I could not agree more.
And we have vet clinics. I think every vet clinic has so many patients. There is no world where a vet would want to treat so that you have to come back.
Yeah, it's so much more time consuming for you guys, us, the vets. That's time and money that you might not necessarily have for another office call, a different round of antibiotics, a stronger antibiotic that's going to cost more money that you have to be on longer. Like UTIs, finish those antibiotics, because those can develop into crystals. And now you are up a creek, and now you're on specialized food that's also buccal on top of antibiotics, on top of pain meds, on top of hospice appointments. Stay diligent in your treatments, and you'll save lots of money.
Because if I had $1 for every time a half-treated patient turned into a surgery patient, well, I wouldn't be very rich, but I would be rich.
You'd have more money.
Yeah, I would have more money. But unfortunately, in the tech field, we don't get paid enough.
It's true, for veterinary nurses, absolutely. It's the pickings are slim for vet techs, and it's very hard work. And anyone that's vet tech knows, and anyone who has not, there's just no way to experience it unless you become a vet tech. It's very
Honestly.
hard work.
It
is.
It is.
It is mentally, physically.
That's
That's another thing that could be said is that
to
to think about the mental well-being of the vet staff you are handling, because in any given day, we go through the most bipolar day of we have beautiful patients that we love so much that are doing well. We have puppies, and then we have patients that
just aren't getting better, whether it's because of owner compliance or they're going downhill, or we know that these patients aren't being taken care of to the best of the owner's ability. And that is so frustrating and draining. And, you never know. PTSD, what kind of day this person is having. We're doing our best to show up to every appointment with a smile. And we probably cried in the kennels 10 minutes ago.
Because we just got done with appointment euthanizing one of our very favorite dogs.
Oh
as
my
we
gosh.
just got done doing that. And then we have to go back to a vaccine appointment with a person that we just met. So we have to be at our very best. Right. So give us some, and sometimes we were on emergency and just got done pulling calves hours before this appointment. So be kind and gentle, because vet techs and veterinarians are usually up for very long hours caring for other people's animals. And then we forego coffee and sleep to be at that appointment because you matter and we want to be there for you and your animals. So if we're a little snappy or tired and it's just, or you think we're not in the appointment, like mentally, that's not true. It's a lot. We were just up very late saving lives somewhere, and we forewent sleep and coffee to be there. So be kind.
Yeah. And if we were in it for the money, we wouldn't be in it.
Oh God, because it's so much. It's good and it's hard. Right. Vet techs and veterinarians, they get burnt out a lot, but I can't imagine my life without being a vet tech. It's been great. I've learned so much, and it's absolutely what I want to do for the rest of my life. I've purchased a little clinic, so obviously I'm in it. So
yeah, that's it. It's incredibly rewarding. It's incredibly hard, but I agree. I wouldn't want to live my life without having experienced what I've experienced. And, I still think about my patients, and I still wonder how they're doing, and I still cry about some of them, and we love your pets.
Yeah, we love you guys. We want you to have the best. Like my Leopold, I had him for 17 years, and I want you guys to have dogs that you are soulmates with for 17 years. I want to make that possible. Like, how did your dog live 17 years? Well, let me tell you how I did it. Let me help you educate and get the fullest life, healthiest life that your pet can have. Let us help you with that. That's what we're here for. So let us help you. Anything. Ask a tech. Ask a tech. They've been through it all.
And we love to teach. We love owner education. It's a huge part of our job. And I mean, if you've noticed anything from this interview, we love to talk.
Oh, we do. We are chatty. We have chats. Vet techs are super good at it, and they enjoy it. I love a good chat, as you can tell. I am invested. Please ask me, because again, I've got over a decade and a half of experience, and the techs like you have gotten to work with, you learn something from each other, and it's teamwork. You got to make it through your day. You rely on these people to get through your day. We're full of animals. We were full all day, every day, and you need that other person to help you get through that day. So they are experiencing the exact same thing, and they know, and they work hard, and it's a thing being a vet tech. It is.
It is.
Well, thank you so much for being on the podcast. This was the best time. And I would love to stay updated. So, personally, between me and you, I would love to stay updated, especially on the business side of things. Thank you so much for sharing your wisdom on this podcast. You've even clarified verbiage for me. I feel like this has been so good for my mental clarity on some things. So I've learned so much. I hope everyone listening has learned so much.
Of course. Thank you for having me. I'm happy to help anytime.
Thank you so much for tuning into Hounding Harmony Dog Training. If you found this episode helpful, it would mean the world to me if you'd follow the show and leave a quick review. This helps other dog owners find the support that they need too. For more tips, training help, and encouragement, follow me on TikTok and Instagram at HH_dog training, or you can check out the resources in the show notes. Until next time, keep hounding that harmony.